Hello, Prof.
Selamat pagi.
So, Prof. What do you think about Wocare?
I'll look into that.
I think that there's some incredible things happening in Indonesia, very exciting things. And what I love about what you are doing in Indonesia is that you all work together and you all share resources. And the most important thing is education.
So, what do you think about what is the importance of nurses going on Wocare education?
Very important because there's always new advances in the field. There's always new things to learn and new ways of doing things. And that's why it's so important to continue your education in Wocare.
So, what do you think about what kind of strategies that we can accelerate for nurses to, accelerate Wocare education?
I think communication and sharing, like even advertising when you're doing education sessions and working together.
Do you think it's possible to do like internationally education for Wocare?
Yeah, there are a lot of universities and private facilities around the world that are doing education in wound care. I think it's important to have core competencies and standards in wound care, and they should be set by the experts internationally. But it also needs to be relevant to the region where it's taking place, particularly when it comes to resources. So the education needs to be of standard but be relevant to the patients that you're dealing with and what access to resources you have.
So it should be correlated with the local context.
Absolutely. So upskilling and making them the experts so they can then train the trainer. And then it's education's relevant to the region.
Thank you, Prof. Dolly. And I think there is a case that Mr. I was trying to discuss about a specific case about stomach first. In the case of Indonesia, would you like to give your opinion?
So I can only give opinion around science and the evidence, not being a clinician.
All right.
So it's probably best to ask the expert clinician.
All right.
But I think the most important thing is assessment.
Yeah.
Assess patient, what's happening with the patient, also what is happening with the wound, and what the goals of care are for that individual, and whether they're in the acute care setting or going home. Goal of care may be effective. So that's probably the best advice I can give. And then using evidence-based practice to manage or divide the treatment pathway that's appropriate for that patient.
Thank you, Prof. Kelly,
Thank
for
you so
your
much.
time. We're really
Thank
having
you.
fun, and it's really an honor for us to have you in the interview.
It's my pleasure and my honour. Keep up the great work you're doing. Thank you.
Bye-bye.
Bye.